All right, so let's start talking about anxiety disorders. I'm going to go over a brief overview and dive right into the symptoms as well as the different types of anxiety disorders. All right, so I'm sure we've all experienced anxiety in our lives, and that's a part of normal life. But people that have anxiety disorders frequently have intense, excessive, and persistent worry and fear about everyday situations. So, commonly, anxiety disorders involve repeated episodes of sudden feelings of really intense anxiety or fear or terror that reach a peak within minutes. So, panic attacks are very common. These feelings of anxiety they can interfere with your daily life, daily activities. They're tough to control and are out of proportion to the actual danger, and they can last a long time. So it's people with the habit might want to avoid places or situations to prevent these feelings, and symptoms might start during childhood or the teen years, continue into adulthood. Examples of anxiety disorders include generalized anxiety disorder, social anxiety disorder or social phobia, specific phobias, and separation anxiety disorder. It's possible to have more than one anxiety disorder, and sometimes anxiety results from a medical condition that needs treatment. So treatment can help, and I'll get more into detail about the different types of disorders very shortly. But first, let's go into the symptoms. So one symptom is feeling nervous, restless, or tense, having a sense of impending danger, panic, or doom, having an increased heart rate, breathing rapidly, also known as hyperventilation. So there's that, sweating, trembling, feeling super weak or tired, having a lot of trouble concentrating or thinking about anything other than the present worry, having difficulty sleeping, experiencing gastrointestinal issues, having difficulty controlling worry, and having the urge to avoid things that trigger anxiety. So those are all common symptoms of anxiety disorders. So let's go through a bunch of different types. So one type we have here is specific phobias. So these are commonly heard of. So these involve a specific fear, right? So when you're exposed to a specific object or situation and a desire to avoid it. So a lot of people have a phobia, maybe social, and another one is social anxiety disorder. So specific phobia is a specific fear, Social anxiety disorder, or social phobia, this is going to involve a very high level of anxiety and fear, and the person's going to want to avoid social situations due to feelings of embarrassment, self-consciousness, and concern about being viewed and judged by others. Separation anxiety disorder, which I mentioned, it's a childhood disorder, which the child will get a lot of anxiety, which is related to the separation from parents. Selective mutism, that's a consistent failure of children to speak in certain situations. Panic disorder, this involves repeated episodes of sudden feelings of intense anxiety and fear or terror that reach a peak within minutes, or panic attacks. You may have feelings of impending doom, shortness of breath, chest pain, or a rapid fluttering or pounding heart, which are called heart palpitations. These panic attacks can lead to worrying about them happening again or avoiding situations in which they've occurred. I know somebody who had this when I was in college, and it was my good friend's girlfriend. She had this disorder, and he would have to leave. He would be hanging out with us, and he'd have to go leave and calm her down and care for her because she would have these panic attacks. Generalized anxiety disorder, this includes persistent and excessive anxiety, worrying about activities, events, sometimes even ordinary and routine issues, things that go on in everyday life. The worry is clearly, it's going to be way out of proportion than the actual circumstance. So it's going to be blown out of proportion. They're going to feel a lot more anxiety and worry than a normal person would in that situation. And it often occurs along with other anxiety disorders and or depression. It's anxiety disorder due to a medical condition, so symptoms of intense anxiety or panic that are caused by a physical health problem. So a health problem of some sort is going to lead to that. Agoraphobia, this is a type of anxiety disorder in which you fear and often avoid places or situations that might cause you to panic or make you feel trapped, helpless, or embarrassed. So let's go in, there's some more here. So another disorder that we have is PTSD, post-traumatic distress disorder, and this is going to be caused by experiencing or witnessing a terrifying event. And I do, my great uncle, he suffered from this. He fought in Vietnam, so obviously that's a very traumatic experience. And a lot of this is typical for a lot of people that served in the military, or maybe a car crash, maybe your house is on fire, things like that that are very traumatic experiences are going to lead to potentially post-traumatic distress disorder,